Where did you get the £30 billion funding gap for? Why do you think there's going to be that much of a gap?
Well, because the now retired or retiring NHS Chief Executive, Sir David Nicholson, actually said that's what the gap would be by the end of this decade. And actually, Nuffield Trust, the independent health think tank, said it could be over 40 billion. So we've used the most conservative estimate. I don't think there are too many people I've spoken to who are in the know across the parties privately think there won't be a socking great financial black hole by the end of this decade for the NHS.
Without new sources of funding, which is what you're proposing.
Well, we're saying some other things as well. We're saying the NHS is not as efficient as it could be. And we're in good company there, because Monitor, the regulator, is saying the same thing. So there's about £18 billion worth of savings, which they think the NHS, if it really put its shoulder to the wheel, could deliver. But any way you look at it, the funding streams look inadequate to cope with providing a good quality health service with the disease profiles we've got and with the demography we've got.
And this, because health spending is devolved, you're talking about England here.
I'm talking about England.
Right. But it will go against the grain, won't it? It will go against the grain of the majority of people in England who will say it has to be free at the point of use. That's what it was set up to do, and that's how it should remain.
Well, we respect that. I mean, I would like to be able to go on putting more money into the NHS, but I just don't think you can go on shoving more money into the NHS from general taxation with the situation we've got. So we've got to look for some other ways, but we've also got to look at finding some creative ways where we can get people to engage with looking after their own health much better than we've done so far.
Right, but your proposals for a £10 charge for everybody to become a member, if you like, of the NHS is what you're proposing as a starting point.
That's a starting point, but we're also proposing lots of exemptions. We've got exemptions for prescription charges, and we're saying there should be some exemptions for children, for example, and for poorer people as well. Right,
so it would be means tested. What do you think the reaction will be?
Well, the Labour Party's already said this morning that there is no prospect of this being introduced by the Labour Party ever, that their position is long-term that Labour would keep the NHS free at the point of use. Now, I commend Lord Warner for thinking seriously about the big funding issues that are coming up in the NHS. I think we are facing a big funding crunch in the next 5 to 10 years, but for me, you talked about membership of the NHS. For me, one of the wonderful things about the NHS is that from the moment you're born, you are a member. You do not have to pay a separate charge. It's paid for out of taxation. And when you turn up a hospital, you don't have to worry about whether you've paid your bills or not.
But it's not affordable, according to Lord Warner. It's not sustainable if we want to still be able to treat the wide range of illnesses and diseases and the ageing population. Do you accept that?
I'm not sure I do. I think there's still a case for it being funded through general taxation. I mean, in fact, the most popular tax increase of all time was Gordon Brown's 1p on the rate of national insurance to fund an increase in spending on the NHS. The NHS is...
And you think people would take another increase, do you think, in general taxation to pay for that?
I think if we have those shortfalls, it's the kind of conversation we have to be having.
Right. I mean, should spending still be ring-fenced?
No. And I think it's wonderful the Labour Party has turned this down, because no one has had this report before today from the Labour Party. So I find it rather difficult to see how they could have given very serious consideration to what's in the report.
Right, so you're really saying that they're just not taking any notice of it, or they're not going to think about it because politically it wouldn't be palatable?
I think they've actually got to revisit some of the issues around the NHS. I'm interested in preserving the NHS for my kids and my grandchildren.
What are the other charges that you'd be looking at? You say that would be a starting point. What about charging to go and see your GP? What about charging for food in hospital? Are those things that you would look at?
Well, what we've tried to do with this membership idea is not actually have a charge for GPs. We've tried not to put a barrier into people going to the GP when they feel the need to go to the GP. This is an annual subscription. We have suggested that one of the things to be considered, as in France and Germany, is a small charge for the hotel costs of being an inpatient, particularly if you're in for an exceptionally long period of time.
It may not surprise you to know that the Unite union has put out a press release saying that you have a conflict of interest because you have links with private healthcare companies. What do you say to that?
Well, it's rubbish. They're out of date.
Right. You haven't got links to private healthcare?
I haven't got any.
Right. I mean, they will say that there is a conflict of interest where there's this privatisation of the NHS. Is that how you would see it?
No, I've always used the NHS. My kids use the NHS. I should go on using the NHS. But I should probably be a bit more selective about which hospital I place myself in the charge of.
Right. And in terms of social insurance, one of the other things that is mentioned, do you think that would ever be politically palatable?
Well, look, I mean, they have social insurance in France, which is a far more left-wing country in many ways than our own. However, I just think within the UK, it is so much within the day-to-day conversation around healthcare that it is free at the point of use, and I just don't expect that to change.
Doesn't look as if it'll happen in the near future.
Oh, I don't know. I've actually seen today there's been a survey of MPs across the party. Nearly 50% of them actually say that the NHS won't be free at the point of use.
That was Conservative MPs, though. I doubt that would be replicated amongst
39
Labour MPs.
Labour MPs in that.
All right, let's leave it there. Lord Warner, thank you.